Now we're going to see the cephalosporins. We have first, second, third, and fourth and fifth generation. The first generation are cefazolin, cefalexin, cefadril, cefadroxil. These, the most common are cefazolin and cefalexin. Cefazolin is used as prophylaxis for Staphylococcus infection in the surgery, in pre-surgical prophylaxis. The first generation cephalosporin covered cocci, gram-positive cocci, but also some bacilli, gram-negative bacilli, Tatar proteus, Klebsiella, and Escherichia coli. So the mnemonic is PEC. The uses are mainly for Staphylococcus infection, so would be endocarditis, osteomyelitis, cellulitis, and septic arthritis. If we have a Staphylococcus that is sensitive to methicillin, it's also sensitive to cephalosporins of first generation and to penicillin that are resistant to penicillin. The penicillinase resistant penicillin that are dicloxacillin, oxacillin, cloxacillin, and nafcillin. Next, the second generation cephalosporin are cefotetan, cefoxitina, cefoxitin, cefaclor, cefuroxin, and loracarbev. Cefotetan and cefoxitin are the only second generation cephalosporin that cover the anaerobes. Cefuroxin is the only that cross the blood-brain barrier, and cefotetan, cefoxitin, major adverse effects are bleeding because of interaction with the platelets, and so the patient has thrombocytopenia, and disulfiram-like effect. Next, cefuroxim, cefaclor, and loracarbev are used for respiratory infections, mainly otitis media, sinusitis, and bronchitis. Also, these cephalosporins are used in intra-abdominal infections, for example, anaerobic infections, so we will use cefotetan and cefoxitin. Also are used in inflammatory pelvic disease. Next, the third generation cephalosporin, ceftriaxone, cefpodoxim, ceftazidime, and cefdinir. Cefixime also. The most important are ceftriaxone, cefpodoxim, and ceftazidime. Cefpodoxim does the same as ceftriaxone, just that is mainly used in children in who we don't want to give ceftriaxone, because ceftriaxone displaces the bilirubin from the albumin, and so the child has bilirubinemia and then kernicterus. Ceftriaxone is mainly used in adults for disseminated Lyme disease, gonorrhea, and meningitis. It is very important in the empiric management of meningitis and sepsis. It's also commonly used in community acquired pneumonia. And ceftazidime is the only third generation cephalosporin that covers Pseudomonas. Next, the fourth generation cephalosporin is just cefepime, covers Pseudomonas, has better coverage of Staphylococci than the third generation cephalosporin. It's also used in pneumonia associated to the ventilator, because pneumonia associated to the ventilator is commonly caused by Pseudomonas or Acinetobacter. And in fever, that is an infection with fever of, let's say, unknown origin, so we do not know the cause of, we do not know the microorganism, and we suspect that it's some microorganism, and we know that the patient is fever. And in a patient with neutropenia. Absolute neutropenia is less than 500 neutrophils per cubic millimeter. And fifth generation cephalosporin also covers, as the fourth generation cephalosporin, gram-positive and gram-negative bacilli, but unless fourth generation cephalosporin, fifth generation cephalosporin do not cover Pseudomonas, but covers MRSA, that is methicillin-resistant Staphylococcus and Enterococci, things that the microorganisms not covered by the first to fourth generation cephalosporin. The adverse effects are, we already saw, the sulfuric effect for cefotaxime and cefoxitin, bleeding for those also, hypersensitivity reactions, cross allergy with penicillin. Remember, if the allergy is just a rash, we give penicillin or we give cephalosporin. If the allergy is anaphylaxis, then we do not give these antibiotics and we give some others like a macrolide, like erythromycin or azithromycin or clarithromycin. Next, other adverse effects are nephrotoxicity, that is increased if the patient is taking aminoglucosides, could be amikacin, gentamicin, tobramacin, and some deficiency of vitamin K. Also the Coombs positive test, but usually there is no hemolysis as opposed to penicillin. Adverse effects covered. The cephalosporin are mainly excreted through the kidney, so we should reduce the dose in a patient with kidney failure or renal failure. But ceftriaxone is excreted through the bile, so in that case, if we have a patient with kidney failure or renal failure, we should not reduce the dose of ceftriaxone because ceftriaxone is excreted through the bile.